Good morning, everybody. Thank you so much for joining us today. We are so excited to bring you another Women's Health Tech Wednesday today. Joining us today, led by a conversation led by Gati Durrani. Joining us is also Heidi Edelstein and Karen Patrusky. Thank you so much for joining us and welcome.
Thanks for having us.
Yeah, I'll hand it over now to Gati. Thank you so much.
Yes, thank you, Justin. Thanks everyone for joining. Really excited for this conversation today with two great innovators that will talk to us about their company and their journey. Really excited to host this session. Wanted to first, just highlight our sponsor, which is Call Doctor, the national leader in on-call ventures. So wanted to just kick it off with an introduction. I'll introduce myself quickly, and then Karen and Heidi, the founders of the company we'll be speaking to today, will go next. So my name is Gati Durrani. I'm part of Pfizer's Digital Innovation Lab. I support all of our interactions and partnerships with the startup ecosystem, everything from scouting and seeking out new and established firms that have capabilities that we're looking for, as well as bring them into the organization, conducting pilots and scale up for their concepts into our business structures. So really excited to meet a company like Verbena, who is the firm we'll be focused on today. So I'll pass it to Karen Patrusky and Heidi Edelstein to give an introduction about themselves, and then we'll jump into some questions about their company. Thank you.
Great. So thanks for having me here today, us today. My name is Karen Petrosky. I'm a physician. I'm a OBGYN. I trained out of Mount Sinai in New York City, and I have been in clinical practice for about 25 years, taking care of women at all stages of their life, from the adolescent to the menopausal woman and everything in between. I started Verbena really organically by recognizing deficits from both the perspectives of the patient as well as the physician, and really wanted to find a solution as medicine has changed in terms of finding a way where we can keep all of the participants content, happy, and still deliver quality service. And I just want to recognize today is National Women's Doctors Day. So I'm especially grateful as a woman doctor taking care of women to speak for women today. So thank you for that.
Thank you, Karen.
We'll pass it over to Heidi.
So I will add to that I am not a doctor, physician, but I am a daughter of a female doctor who really her practice was focused around women. So I'm in the same family, so to speak. So, but I'm not a physician by trade or by education. I am I'm a brand marketer. I guess I'm considered a marketer of brands, and I've done media marketing in the women's lifestyle category for over 25 years. And I have a passion for bringing brands to life, their personalities, their visuals, through marketing campaigns and programs. And Karen and I've had the opportunity of late, after I've gotten out of the corporate world, to launch some really exciting consumer brands and services, particularly for women, and especially Verbena. And Karen and I are a perfect sort of synergy, because she brings the physician practice, clinical care and medical, and I bring the business and marketing to our new adventure, if you will. So that's sort of my background and how we sort of merged together.
That's great. Yeah, there's nothing better than a women's partnership where you complement each other's skills. And happy National Physicians Day, for Women's Physicians Day too, Dr. Patrusky. So speaking of that, would you want to explain just kind of your journey into the OBGYN field and women's reproductive health?
Oh, absolutely. So becoming an OBGYN, in particular, and as a specialty, was very natural. I, of course, wanted to advocate for women. I really wasn't on a journey necessarily to change the world, but just wanted to do my part in terms of taking care of women, because women's needs are highly underrepresented in healthcare. So, studies, clinical trials typically revolve around men, and issues that are just so important are often sort of swept under the rug or considered secondary. So whether it's issues relating to menstrual problems, nobody really talks about it. Women's reproductive rights are, and access to contraception is not recognized as it ought to be. And then what's really prevalent now, which I'm very excited about, is really breaking that glass ceiling in terms of menopause and discussing it and not making it taboo. So it was important to me when I first decided to embark upon this specialty, was to just address those sort of basic needs and basic rights to deliver not only health, but health care to women. More than that, I loved the specialty because it had a lot of variety. So again, taking care of women at all of the different stages of their life. It also was related to not well care, but could be procedurally based. So it had a lot of variety, and in my opinion, never was really dull. And then the most important reason why I chose this field, and probably one of the reasons why we're sitting here today, is I chose this field because of the connections and the personal relationships that you make with patients. And those relationships tend to be lifelong. So I'm at this stage of my career where I am delivering the babies of babies that I delivered. And so I've been with these women for their whole lives, as a newborn, as a teenager, now delivering their babies, still taking care of their mothers and their grandmothers. So it's truly a privilege to not only become part of these individual lives, but become part of the lives of family. And that was really my draw to the profession. And then how Verbena came about, really noticing these deficits that are occurring as we evolutionize into the tech world.
Yeah. So given that, your long tenure in the industry, how would you say the practice of being an OBGYN has changed in the past 25 years or so?
So medicine in general has definitely changed enormously, and so much of it for the better. We're diagnosing diseases sooner and able to therefore treat those conditions more effectively. Surgical procedures are done much more efficiently and much more effectively, so that is much better for patient care. But there have also been some negative changes. And those negative changes, in my opinion, really, I noticed them most as technology had evolved, which was initially thought to augment the field of medicine, but in many respects acts as a ball and chain. So what I mean by that is, with the advent of the electronic health record system, that complicated medicine. It increased the burden to the provider, and it did so because they had so much more responsibility in terms of data entry, administrative changes. There were so many tech roadblocks that needed to be addressed. And what that ended up doing was pulling them away from direct patient care, which is very likely the main reason why a physician chose that field to begin with. So that, to me, as I said, the main reason why I went into the field was to be connected to the patient. But when we're sort of stuck to dealing with all of the paperwork, or the digital paperwork, that acts as a deficit. And so that was my call to action, to try to improve that aspect.
Yeah, that's great. And so, that's great background on what brought you to start the company. Maybe we can give the audience like a quick summary of what Verbena is, and your kind of main goal through the platform.
Yeah. So digital health and women's health and all these aspects are exploding, and a lot of this has happened since COVID. And it's important to recognize that the concept of this company did not come about because of COVID. This predated the pandemic by 5 or 6 years. What I wanted to do was really try to find a solution that enhanced the physician-patient relationship, the one that has eroded over the years. I wanted to look and recognize that issues that could be treated without having them come into the office, but not sacrifice the quality of care. So the initial concept came about with really just dealing with birth control and contraceptive issues. And once the pandemic hit, I broadened the breadth of the platform to incorporate any issue as it pertains in women's health, from menstruation to menopause, that can be easily, efficiently, effectively completed through a virtual first approach. And what I wanted was something that also made the delivery of the digital option to be easy for both the patient as well as the practitioner, so that everybody feels satisfied on the journey, on the experience that they would have. I wanted that patient to not have fragmented care. I wanted her doctor to essentially be holding her hands throughout that whole journey. And what I mean by that is, what the Verbena platform does is it's a telehealth platform with the physician at the fulcrum guiding her patient through, so that she has the option to enter the digital front door for her basic needs. But at any point, if she needs her level of care escalated such that she would need an in-person visit or something procedure oriented, she's already at that person's door. She already has her physician knowing exactly what the problem is. So it really dovetails the traditional legacy system with the new age of telehealth and digital medicine.
That's great. No, thank you for that background on the company. I'm going to move to Heidi for a couple of minutes. So Heidi, maybe you can just give us a background on how you got involved, and kind of your role with the organization.
Well, first and foremost, as a friend, I was intrigued with what Karen was envisioning, and I wanted to support her and help push this concept forward. Personally, we were driving out to the Hamptons over 4 years ago, 3 summers ago, which is 3.5 years ago. And she was telling me about this business, which was actually different than what it is today. And we can talk about that at some point. But, I was like, wow, this is really very interesting and engaging. First, also, my father was an OBGYN for 50 years, and Karen and I always had this sort of connection about it. And I had firsthand experience, firsthand, secondhand, once removed or whatever experience about, OBGYNs and what they go through. I noticed the relationship between my father and his patients. Many of them were my mom's friends. They became my friends. He delivered, as Karen mentioned, my friends, and then he started delivering my friends' kids. So that's always had a special place in my heart. So that was what intrigued me, our friendship and sort of the women's health category. But then, as a marketing and business person, I thought that I could help take this with Karen to the next level. And initially was easily able to come up with some initial branding concepts and visuals that helped us bring this to life, and actually create a real brand. We were like, oh my God, this is a brand. It's a logo. It has a this, that, the website. But then from there, as I did a little bit more research in the category, as we got the couple years went by, because there's a lot of sort of things that happened in between, we noticed that there was a huge void in the women's digital health marketplace. And while there were similar options when we first started available, they were nothing like what Karen had envisioned, which was really maintaining this personal connection between the physician and the doctor. And, first of all, I'm a patient first, a marketer second, or a marketer first and a patient second. So I could bring that perspective to it. And, and then as COVID evolved, everything changed again. And we
Right.
saw how we really needed a strong digital health solution that would keep the connection between patients and doctors. And that actually sort of catapulted us into a whole different sort of speed in moving forward with this concept. So again, it started at friendship, and then it became, wow, this is smart. And then it became, very interesting. And now it's become, a passion together that we're doing as partners and friends.
That's great. No, it's great to have both that professional and personal kind of connection to the organization. So what excites you about Verbena?
Me?
Yes.
Oh my God, I could go on. I mean, at first and foremost, I'm a marketer. And then it's not fair to say I'm a marketer and I'm a patient and I'm a consumer. And, I got excited about given the opportunity of a blank slate and being able to work with Karen, and we've had a lot of great people over time been involved and sort of bringing this to life. And I absolutely believe in a women's health platform. I absolutely believe in a women's health first platform. Digital is where we're going and where we're evolving. And if you don't sort of jump in now, you're going to be too late. And I've been in an industry, I grew up in an industry, in the publishing industry, that went from sort of paper to digital. And I was like, whoa, I came in a little bit too late. And then I sort of jumped on the bandwagon. And now I'm like, digital, it is office visit and house calls and telephone calls and on call and answering services, but digital health is where it's at now. And I'm excited about it. And I'm excited about this women's-centric, women's first digital brand.
That's great. That's great. Karen, so coming back to you, you've been in kind of the women's health space for some time. What would you say is different about Verbena from other health tech companies?
Yeah, so I sort of lump the type of digital health companies into sort of two baskets. One are the digital health companies that have completely cold cut out the physician. And I recognize that they serve a purpose in terms of they're efficient for the patient. It's a quick fix, but it's incomplete care. And to me, that as a physician, understanding that fragmentation, incomplete care, they all have sort of the modifier, if we can't help you, call your doctor. To me, that just doesn't make sense. When COVID hit, doctors' offices had to just jump on the bandwagon and basically did Zoom conferences in order to satisfy their patients' needs. And that did serve a purpose. And it was, in some respects, great for the patient. And when physicians had the time when they weren't seeing patients in the office, it served the purpose for the physician as well. But now when we're a little bit more back to business, those platforms to me are very inefficient, they're clumsy and time consuming. And so what I need to happen, especially as it pertains to women's health, is to have a much more efficient telehealth visit. And that's what Verbena does. Like Heidi mentioned, it fills a white space in the marketplace because there are no platforms that are women-centric and physician-facing at the same time. And in combination, what the Verbena platform does is it uses a lot of tools. It uses an abundance of functions and features to really streamline that visit so it becomes a very precise visit and a visit with intention, so that you get the efficiency and satisfaction that the patient needs, but it also augments the physician's capacity to see more patients and helps them. We see that women are so busy. We're recognizing that probably now more than ever, right? They're still working. They're potentially teachers to their children. They may be taking care of their elderly parents. They may be students. They don't have the time to make if they're having a problem in particular, but to call and make an appointment. Maybe they won't get that appointment for a month or two in advance. They're going to sit for hours in the waiting room to be rushed through the appointment. What they need to feel is that they have their trusted physician at their side really whenever they need it, because they do feel it and have that in every other consumer industry, but they don't have that in the healthcare industry in particular. And we need to not be resistant to change, but we need to be resilient and find a way to satisfy our patients with quality while still being kept whole as the physician. So that's really what the Verbena platform does. It's accessibility and efficiency.
That's a great vision. So where would you say you are in terms of stage of development to deliver on that?
Yep. So we are early stage. We are building out, or we have the architectural plan and wireframes for all of the user journeys. We have things built from the patient's perspective, from the physician's perspective, as well as from the administrator perspective. We are starting development now, and at the stage where we're looking for funding to really get this so that we can get this out to market quickly.
That's great. That's great. It's an exciting part of the journey, and
it's amazing.
The kickoff. Yeah. So how did you come up with the name Verbena?
Well, I'll leave that to the marketer.
Okay.
That's my favorite thing in the end. So it's a long story, but we'll make it short. It's a really super fun story. And it's evolved over the last 3 years because we actually had 2 pending trademarks. I hope I can say this prior to Verbena, but Verbena is the best. We started out, I'm sure I can share this, but we started out primarily as a birth control renewal platform, and we had I control my birth control, and we actually probably still have the URL for that. We absolutely do. Yeah. And then as we shifted into more of a general women's health solution platform, we have our beloved name, Her Health Now, which we probably still have that as well. But then we had some, I'm giving you a long story, some trademark issues. And we had to pivot really quickly, which is where the fun stuff started to happen. And we had a bunch of creative people, including myself and Karen. And we would really, I'm not joking, we would spend hours and hours with lots of people, big groups, small groups, trying to go through the brainstorming process of how should we change our name. We had 2 strikes, 3 strikes, you're out. So we had to get it the 3rd time. So we were like, okay, should we be more female centric, more healthcare centric? We came up with, lots of words with health and her and she and care. And, we went back and forth, and we couldn't find a combination that either wasn't already taken or just was like a me too. So then we're like, okay, let's go to something a little bit different. Let's start talking about women, females. We started talking about female names and female body parts and Greek goddesses and female symbols, and it was super fun. And we had to do so much research to make sure that we weren't sort of stepping on other people's toes at the same time. And we kept moving forward, and then we fell into this floral direction. And and then that became flowers. And flowers actually have male and female reproductive systems. In fact, an ovary is a female reproductive health organ. Who knew? Because I'm not like, a gardener. And not to mention that flowers are like feminine and sexual. Oops, sorry, that's sensual, and just sort of it's very sensual. There's a lot of contemporary artists out there who do wonderful flowers. We actually, Mapplethorpe and Georgia O'Keeffe, we really went into so deep into this. Karen's smiling because it's my favorite story ever. And then we're like, okay, let's look for a flower that means something. What does it mean? What do they look like? What do they symbolize? What are they used for? And and what did the word actually mean? I mean, we spent, I'm not even joking, so much time together doing this. And we were leaning towards, and a group of names, and I can say them, Delilah and Dahlia, that were very difficult to read and to even pronounce. So we just moved forward, and we got some prodding, and we came up with Verbena. And Verbena stands for protection and healing and creativity and happiness. V for victory, virtuous. The Latin root means true and truth. And our favorite is, we know there's a lot of, female anatomy that begins with the letter V. And then our favorite, do you want me to quote the Urban Dictionary, Karen? Because it's our favorite thing, or is it, we're running out of time?
If it's your favorite thing, you can certainly quote
You
it.
can do it. And then we do have a couple questions. So.
Okay, so because this is the favorite. Okay, so the Urban Dictionary, I have to read this. The Urban Dictionary definition of Verbena is a cool, funny girl who is such a great friend. She's flirty and gorgeous and has so many admirers. She can't count them. She stands by you whenever because she's super loyal. She cares about you so much. And if you ever have a friend like Verbena, you should know you're lucky. So
Nice.
that was it.
And you didn't write that. No.
Karen and I are Verbenas. So there you go. All right.
That's wonderful. So I know we only have a few minutes. So, if anyone has questions, just type them into the Q&A, the box. There is one from Kritika. She's asking if there's any mental health component to the support offered on your platform.
Yeah. So as this evolves and broadens, certainly will be. There are emotional health issues that will be addressed in terms of dealing with PMDD, the premenstrual mood dysphoric disorder. So that is a component of the platform, as well as issues as it pertains to postpartum emotional changes and depression, as well as the emotional changes that can occur due to the hormonal changes that often can accompany menopause. So we are not a mental health platform per se, but have sort of cherry picked the emotional issues that can occur at different life stages for women based on her reproductive health state changes and where she is at that stage of her life.
Got it.
I hope that answers the question.
Yeah, and I'm looking to see if we have any other questions from the group. So feel free to throw one in if you have one. But as we wrap up, I do have one more question for you guys from myself, if that's okay. Where do you guys see yourselves in a year with your product?
Yeah, so the goal is to get this rolled out soon, to get this in the hands of as many providers who care for women, in particular in sexual and reproductive health, and for them to get that integrated into their communities. So fast forward in a year, we'd love for thousands of doctors to be using this alongside with millions of their patients.
That's great.
But I would love to add in 3 years, I would love for Verbena to be a women's health first brand that people go to for content and community. We want to be a household name. We want Verbena to be synonymous with women's health care and a one-stop shop for both patients and physicians for quality and affordable and accessible care and consultation.
And just to add as well, this is a valuable product to insurance companies. It definitely drives down the cost of a visit. It is value-based. It eliminates unnecessary testing and therefore really enhances the healthcare system, which is so wasteful. I see it as an opt-in for large employers to offer it to their employees so that when a woman has a UTI, she doesn't have to take an entire day off of work. Right. She can be treated effectively and efficiently and not detract from her other responsibilities.
That's the future of healthcare.
Correct.
And then one last question, and then I think we'll need to wrap. A question from Suzanne. Yeah, you mentioned, Karen, you guys are working through wireframes and architecture. What's the UX view on this? How are you focused on making it user friendly?
Yeah, so it's going to be certainly user friendly from for all participants. We are going to have a mobile friendly app for patients to log on that will link directly to their doctor. So it will be branded to their doctor. So they're not going to feel like they're talking to the platform. They will be conversing with their provider. It is going to link to that provider's electronic health record system. So that will make that provider more efficient. But the visit is streamlined because that woman will be able to do a deep dive into her problem at her leisure and in her home space. So what that does is, as I might have mentioned, it really streamlines the visit. It becomes a visit with intention so that it's an efficient way to address her problem.
Yeah, that's great. Okay, so I'm gonna cap it here with the questions. If there are other questions that come up, feel free to reach out to the HitLab team, and we can put you in touch with Karen and Heidi. Thanks for joining us today for our Women's Health Tech Wednesday. Hope to see you guys again next week. And again, a big thank you to our sponsor, Call Doctor, and thank you, Karen and Heidi, for taking time to speak with us today.
Thanks for having us.
Thank you and HitLab. Thank you.
Thank you.